Ashwin Nayak, please. Ashwin, where are you? Awesome. So can you just...
A sequence?
That is Siraj, then is Himanshu. Second is Himanshu. Third would be Ashwin. Ravi Ramaswamy, please. Ravi, can I have you here? Geetu? Yes, ma'am, please. Great. Thanks a lot, everybody, for joining the panel here. This is going to be one interesting, interaction. I see that there are two very distinct set of, things here, or two distinct set of people, from the food industry, from the health industry, and there is somebody bang in the middle who's in neither of them. But
all of them.
Or probably all of them, or catering to all of them. So, but I'll actually go first with Geetu. Geetu, let me understand something from you in terms of when we talk about health, nutrition, and malnutrition, and this problem that we are actually seeing, how do you see that problem here today, and from your perspective?
So I think both from a overnutrition, undernutrition point of view, the issues are growing worldwide as well as in India. I think the need is now more than ever for multi-stakeholder partnerships to very aggressively start forging solutions. From my perspective, I think there are three areas where industry, where health partners, where government can work together. I think the first one is that of access. And when I say access, it's a pretty all-encompassing term. Because in the food business, in the food industry, there is a lot of value sitting in the cost chain. And in India specifically, we lose a lot of it from step to step, from farm to fork. There is a fair bit of work that has been happening, and I think with technology, with robotic enabled logistics, etc., there is a lot of work that has taken place. But I think one place where you can actually create value is by making good, wholesome food accessible. And whether that is food which is fortified for undernutrition, or healthier food for people who are obese. So I think access is really key. And I'd be keen to know what the view of the other panelists are on that area. I think the second piece is that of, I would say, habit-changing education. And I think from an industry perspective, one of the things that we do really well is communication. And when you communicate in a way where you're telling a story, you're telling a compelling story, and you're investing behind it, you can change habits. So to give you an example, there are a couple of initiatives that I've been a part of. One was an initiative which was about changing habits amongst adolescent girls in relation to anemia. We know that anemia is a big issue. And I recall we tested a number of communication ideas. And then finally, the one thing that actually worked was an idea which told a story about the fact that today a young girl in the remote part of the country, whether it's near Hosur, in Karnataka, or anywhere else in the country, can achieve her dreams by actually taking care of her health. So you actually linked the fact that, first you need to be aware that tiredness, etc., is related to an issue. And that issue is something you can be empowered to solve yourself towards a higher order goal of achieving your dream. So there is a lot of power in storytelling. At Hindustan Lever, we run a program for children which is on hand washing. And it's a program, in fact, one day in a year, all employees go out to schools and we teach children the value of hand washing. And it's incredible because these are primary school children, and I go to the same school every year. And when you're meeting children of 4th standard, they have met you when they were in 3rd, they met you when they were in class 2, they remember. And they tell you that, we are washing our hands before a meal because it's important that we don't fall in. So I think habit-changing communication is a critical area. And I think the third area is that of empowerment. empowerment in terms of actually bringing financial capability amongst people in the lower economic strata, so that they can actually afford the right kind of food. In fact, we also run a program which a lot of you would know about. It's a program called Empowering Micro Entrepreneurs, Shakti Amma, and we've got 70,000 micro entrepreneurs across the country. So if you basically triangulate access, habit-changing education, empowerment together, there is a lot that can be done in the area of making good food accessible to people in this country. So those are my top line thoughts.
Very, very interesting, Geetu. Moving from Geetu, Siraj. Geetu has actually laid a very interesting framework here, or she's actually trying to paint a picture of very interesting thing: access, behavior changing, empowerment. So these are very big, three broad things. But when you talk about your enterprise, and Cargill has done some exceptional work on nutrition and fortification and stuff, but of course you've also done a lot of work on the ground as well. How do you think the whole huge new impact can actually happen on value chains, how they can actually get redefined, how you're actually looking at a business situation or a business problem and a solution here?
Okay, so I'll sort of continue from where Geetu left off, actually. She talked about access, and so we have been pretty much in the forefront of fortifying vegetable oils, or the edible oils as we call it, and the thought behind that was that edible oils are the largest penetrating staple into the homes, almost 95 to 99%, depending on who's quoting the figures, and they are also the best carriers of micronutrients, specifically vitamins A, D, and E. And then suddenly we realized that we had a product which had so much potential to enhance nutrition or to add to the nutrition. So we took the step of voluntarily fortifying the oils that we were selling into the market. Now, obviously, it's a very fragmented industry, and the oils that we were selling were really about branded oils, so they were going only to a certain section of the society. So the thought was that how do we make it more widespread, and how do we sustain it? Because it was a lot of expenditure. So while my team may have had the thought, the team following me may not want to continue this, because this was really an extra cost which really didn't have any demonstrable returns, so to say. So we said that if we put it out as a competitive advantage, put it out as a marketing communication, and it's not rocket science, anybody can do it, and if the competition also starts doing it, and over a period of time the whole industry starts doing it, because it kind of becomes stable stakes, then the whole purpose is achieved. And because we are marketing it, it becomes part of the brand. Therefore, the individuals lose control over it. Now it's a brand which comes with this fortification with vitamin A, D, and E, and therefore it stays forever. And at the same time, just about every major competitor has done the same. So now it's anyone entering the market with a new product in this category has to do it, because that's the new normal. And I think that was a great example of how some things can be done. But I'll take you back into why we thought that, which is really, as Geetu said, it's really about accessibility. While we can talk about what is, so my original thought was that hunger, which the government has been addressing through food security and a lot of other initiatives, is really about visible impact. It's about here and now, and I called that the body. So whatever you feed is visible. Nutrition is a lot like the soul. You don't see it. Its impact is felt over a long period of time. It takes years for malnutrition to sort of show its problems or its limitations. And therefore, if you have to address the soul, it has to go in the food that people consume every day. And it's not about tablets here, or some foods, or and we always talk about saying, okay, this food is nutritious. People should consume more of this or more of that. But when they don't have access to it, there's no point talking about it. So nutrition has to go into the food which people are consuming. Another point that I wanted to add here was that while I may be fortifying my food, the consumer has to be encouraged to understand that. Because if he doesn't or she doesn't understand it, it's all going waste. So the communication to the consumer has to be in a language which they understand. So I could be talking about my oil has vitamin A, D, or whatever, and they may see it as a marketing gimmick. And so we had to convert that in our communication to the foods that they probably wanted to have, or foods which are declared nutrition, like almonds or eggs or milk, and to say that, okay, if you consume this and so much of this oil in your food gives you benefits equivalent to so and so. And therefore, communicating to the consumer, putting it in products which are of daily use and are accessible to the consumer, and setting a base where everybody in the industry does it, really helped to propagate a concept like that.
Very interesting, but I wanted to have a follow-on question here. When you are doing all this, the basic aversion for a lot of enterprises has been that it is an expensive proposition. If you're fortifying food, it is a cost and it is not really going to give you any benefits over a longer period of time. How did you change that mindset within yourself, or how were you really looking at this value proposition itself?
Okay, so the starting point is, and I've sort of read it in one of the articles subsequently, that, I mean, I've always believed that business needs to build trust with society, because that's been a relationship which has always been fraught with mistrust, and society creates or brings up governments, and therefore the mistrust between the government and the industry. Now, doing it through social responsibility doesn't really take you very far, but also the sustainability is questionable. We do a lot of social responsibility. I'm sure a lot of organizations do that, but how can it be sustained? But what brought us the economic part of it, the whole point was that if everybody started doing it, then there's no competitive disadvantage. So how quickly could we get the whole industry accept that practice would take the cost disadvantage away from it. And more importantly, while it may seem like a great activity and a lot of money going behind it, the per unit cost of fortification is very low. I mean, just to give you a perspective, an 80 rupee per liter oil has the cost of fortification in that is about 10 paisa. So it was not something which was expensive. It was not rocket science. It was just, I think, the desire to do it and see it through.
So awesome, like that's very interesting. Coming to you, Himanshu, you've really worked in this industry of cleaning, and you've been trying to work with the food industry in terms of packaging, or you've been working with the hospitals and the healthcare industry. How do you really look at this? How do you think a value proposition can be built, which is going to be going far off for people, far beyond what we are really doing right now, and which is going to be beneficial for society?
Let me tell you in maybe a minute to what Sealdia does. A lot of us will not know. Sealdia was a bubble wrap company. This is how the business started many years back, 1960s. Today we play in three major verticals. One of them is about food care, and which is completely focused around making the food safer and extending the shelf life. So you have a fresh red meat shelf life going to 90 days. Okay, or you have idli dosa batter, in ambient temperatures, shelf life of 7 days. You don't get it today. That is where the technology plays a role. So we are a technology player, if I may say. On the other hand, other piece we play in is making safer, healthier places where we operate, whether it's an office environment or a healthcare environment. The majority of deaths in a hospital take place not by the mistake of a surgeon, but because of a hospital acquired infection, or but by a poor nursing. Mm-hmm. We help in creating setups which prevent this. So before I come to the healthcare part, let me talk on the food side. I think if you see, I'm talking of some statistics from US, and India is obviously a little behind. 52% of the vegetables in US get wasted. Okay, so that means a farmer is producing it, it never gets consumed, so all the cost, it gets added up in the supply chain, and you pay double the price of what you should be paying. If I may simply add up and say it's an economic cycle. What it means is, what I think, we bring the technology here, working with our front-end partners like Cargill or Levers, create a situation where the food really becomes affordable. We are talking of fortification, very relevant, no debate about it. On the other hand, people die of starvation because the food itself is not available, or the cost of food is higher than what the guy can afford. So the way I see it working is, I think we need to embrace as an industry both the concept and the technology to make it better and to take it forward. It needs some courage, leadership from the industry to step up and change the game. With a purely profit motive to start with, and over a period of time, this automatically becomes a social enterprise, because you are effectively in the process. We make money, you make money, all of you make some profit, but at the same time make the food more affordable for the people, and that to me is how you bring nutrition to the people. Whether it's a fortified, unfortified comes later, but primarily the food becomes more affordable. The amount of food grain loss we see here in the country in the last couple of bumper crops has been phenomenal. It's like, and people die of deaths. There are more rats getting fat in those warehouses than the people when the people are dying. So to me, I think it's about creating a balance, and a technology, in my thought, can create a big role in doing it. That's
sure. Very interesting, Himanshu. I have to come to you, Ravi. You are actually doing a lot of work in Philips, but you're also creating unique models of delivery and really taking care of health and so on and so forth. How did you really reconceive this? And you've heard these three set of people, very interesting perspective. It's about behavior, it's about business model, it's about cost, or it is about managing that, it's about competitive advantage. But what about your enterprise, and how have you looked at the situation?
I think healthcare has been no different in following the same footsteps. We do have the three things that matter to us most is cost, quality, access, and then look at training and change in behavior in terms of diagnostics. Let me sort of start off with some statistics, in the sense that if you look at India is segmented into three regions. I would say the urban, which has something like an 80 million population with about 100,000 doctors. We have the suburban, which is basically the tier 2, tier 3, tier 4 cities with 280 million people and about 200,000 doctors. And then you have the rural, which is 730 million with about 50,000 doctors. So basically what is lacking in India, and this has been in 1978, we had this Alma-Ata Convention, which talked about healthcare for all by 2000. Come 2015, we are nowhere even close to it. And one of the things that we find is how do we empower the people in these, in the suburban and the rural area to come and take charge of healthcare, because cardiovascular diseases or the chronic diseases that are prevalent in India is only going up. India, 1 in 10 almost is suffering either from a diabetic or from a hypertension or from obesity or COPDs, pulmonary disorders. The question is, bulk of it is out of payment as well. So how do we ensure that these diseases are caught and tracked at a very, very early stage rather than allowing it to go, so that you reduce the trauma and the spend? Which again sort of folds back, and I will sort of get back to this and see how it relates to what was said earlier in terms of behavioral change and in terms of nutrition. But suffice to say at this point that we really need to sort of decentralize care and look at care more holistically. I think Philips and I would say even the major companies have stopped looking at sale of devices as a black box. What we are now trying to do is to sell solutions which are going to solve problems for people, rather than saying that you sell an ECG machine or you sell an acute care monitor which will be used in an ICU. The question that comes up is, how do I sell a solution which will sort of track a patient end to end and come up with a definitive improvement in either productivity or the time that is spent in hospital or what have you. The measures that define criteria for success are changing day by day. In the overall, in that sense, now what is happening is, let's take nutrition. Philips has a solution called mobile obstetrics monitoring, where from the time a lady conceives, right till the end of the delivery and beyond that, we try to monitor all the critical parameters, be it blood pressure, be it sugar, be it anemia, be it the hemoglobin content, and a multitude of other parameters, to ensure that both the neonate and the maternal are safe and they deliver a successful and they have a successful delivery. Now, this calls for nutrition also sort of plays into that, in the sense that if hemoglobin is going to go, which anemia is a cause for most maternal deaths. Now, the question is, how do I sort of get over it? It is again by teaching, it is again by changing behavior, it is giving the nutrients that sort of help the mother and the baby to sort of grow in the right way. So it's a intertwining, it's a convergence of various aspects that come into the fold now. It can't be separated, saying that healthcare is no separate. Now, how does the mobile obstetrics monitoring work? It relies on the mobile infrastructure. It depends on the telecommunication network that is there. So what we now see is not isolated silos of technology, but it's a complete convergence. And that's where most industries are driving towards. And the bottom of it all is, one, how do I make a behavioral change in people embracing the changes that are coming up? And secondly, how is it that it is sustainable over a long period of time? How do you ensure that compliance to medicine, compliance to medication, compliance to practices are built up in a sustainable manner? So it's a more holistic approach that is now being taken by the healthcare providers and by the manufacturers of equipment, rather than being looked at it in silos. And that's where the whole thing gets blended up with.
Awesome. Ashwin, building up on what Ravi had actually said, he's talking about some very interesting things. He's talking about solutions. You created a network of hospitals which was phenomenal in tier 2, tier 3 cities. And how did you look at that business model, and how did you actually look at access? How did you look at delivery, and how did you look at technology and creating solutions?
So when we started in 2004, the world was very different, right? And I say that because there's so much has happened in the last 10 years that we ourselves are redefining our business model at Vatsalya. But at that point, the gap that we were trying to fill is rural areas need to have access to medical care just like anybody else. So how do you bridge that gap? And we figured out a way that if we build reasonably big medical centers and attract doctors from urban areas who are from the rural background to go back, it could fill a gap. We've been moderately successful, and that model is now being replicated. So it's basically resource reallocation to make sure that wherever there are patients, we can send the doctors. But what is interesting that in our medical practice or experience, what we are observing is two things. One is the trends on the medical side, and then there's the trends on the health side, which are two different things. On the medical side, I think there are three clear trends emerging. One, a lot of us talked about, integrated approach, right? I think the disease approach of humans is gone. So today we are talking about treating the whole person and not just one symptom, one disease, etc. So that's integrated approach is very clear. The second piece that is emerging is a personalized approach. I think gone are the days when we treat every diabetic the same way. So we have now started looking at individual characteristics of diabetes and how do we treat them separately. The third piece which is emerging, again riding on the telecom wave, is the virtual aspect of it. How do you do remote medicine, remote care, etc. So I call it the VIP of health, virtual, integrated and personalized. But if you look at the other side, which is the health part, interestingly, it's nothing to do with medical care at all. It's all about food, sanitation, environment, and things like that. At Ashoka, this is a big focus area for us. What are the trends that will emerge in the broader area of health in the 10 to 20 year time frame? And we assembled a bunch of experts a couple of months ago from various parts, food, public health, nutrition, medical field, etc. And we asked them to predict what are the trends that they will see in the 10 years which will really impact health. Surprisingly, 4 out of the 4 were nothing to do with medical care. The first one was clearly nutrition. But the beauty of, or the tragedy of nutrition is clearly, like somebody said many years ago, food is medicine. And food is also the cause of ill health. So how do you balance this, right? So on one hand, we have the entire burden of obesity, diabetes and things. On the other side, we have malnutrition. So how do you start focusing on nutrition in a very holistic way? I personally believe that we have gone wrong with the whole overproduction and forgot the nutrient piece. So our green revolution is coming to bite us now. So we have to figure out how to make nutrients the core of our healthcare system. The second piece is how do you bring various stakeholders together? You know, the food people have to talk to the healthcare people, the sanitation people, and have an integrated approach. I think there is some, in the last few years, there is some development, but it could be a great public health sort of initiative if all of us can come together. So that's the second trend. The third trend, again, re-emphasizing everything, the healthcare, a major part of healthcare investment has to go into understanding behavior of consumers and how we can influence it. Healthcare is more and more becoming a marketing field. Right? We have to really play to the emotions of people to affect change. And it's going to be very complex in the next 10 years or so.
Sure. So what I'm actually hearing here is that there is a very, very interesting thing that is coming out. One is that we have to look at an integrated approach. There is a unique business model that has to get created, and it is about you're all solving a certain set of societal problems. If I ask you, say you have to give your answer in 1 minute, then what would you say is, what are the principles that you have to look at to really create this, and from your experience, to create those unique models, to really create those value chains, to create a societal impact? We'll start with you, Geetu.
So in 1 minute, I think we should exploit technology. I think mobiles have exploded in this country, and they give you instant access to consumers across socio-economic strata. And I go back to the same point that I made about education, empowerment through education. And we are the home of Ayurveda, we are the home of naturopathy. We are the home of, we understand that what you are is what you eat. And today there is so much confusing information in the environment about what's good, what's not good. Today's ghee is good, yesterday it was not good. How do you really use technology to empower people with information where they can make the right choices, empowered choices themselves towards health? And I think
information overflow can also create that confusion.
It does. And I'm saying therefore you need to create trust. And I'm saying therefore, different companies, different individuals, different stakeholders giving different messages vis-a-vis coming together and giving concerted messages, which then starts talking about preventive health. It's about an integrated approach. I mean, you want to reduce healthcare costs, and it starts, the genesis is prevention, the genesis is food. Food is good, food is bad in excess. So that's really what I would say in a minute, empowerment through education and really empowered by technology and digital.
Siraj, what do you think?
Yeah, I would think from an organization perspective, it's the organization commitment, the recognition of the fact that we are going to make a difference to the society, and it's not through charity. So within the business that we do, so I'm not talking about the world at large, I'm looking at factors which are within an organization's control, to say that within the activities that we do, what more, or what better, or what different can we do to have a larger impact than just, selling our products or services. And if we go deeper, I think there are enough intelligent minds in every organization, otherwise they wouldn't have been so successful in global, to find those solutions. And then I think large corporations have the ability to transfer these solutions across geographies. And particularly when they work together, just to give you an example, Unilever took the initiative in that this whole thing of sustainable palm, the thing which has now become a global necessity, was initiated by one company saying that we want it to be this way, and then everybody joined. So different corporations will have to take ownership of different, and I'm talking language of corporates here rather than society and government at large, because that's what we represent here. But it's really about identifying causes and integrating them in our business models, which is important.
Awesome. Himanshu.
For me, I think I'll put it in two words: technology and education. And I'm borrowing it from Geetu, what she said. Technology for me is not just a mobile phone technology. Technology is also the way we process the package, the move it around. Education is in prevention, and she said it very well, and I saw it, Ashwin saying the same thing, that, to lower healthcare costs, you have to prevent. And to prevent, you need to improve sanitation, hygiene, which is a lot of education, much more than anything else. So what you need to do is to create access for tools of sanitation, make sure that people are aware and they understand the risks of not doing it and the cost of doing it versus not doing it, cost of going to a doctor versus the cost of washing hands daily, and making sure that these things are available to them in a manner which is affordable. So we have a Soap for Hope program. I'll just create a, I think Snigdha talked about it yesterday in the Partners Day. It's about recycling unused soap from a hotel and making it available to the communities in their own way by reconstituting soap. Very sustainable business model. We are running it across something like 400 hotels in the region. India, we are relatively new. There were some regulatory hurdles about it. So it's getting sorted out. We only are the enablers. We create it. Well, now, how does it help us? The key thing is, how does it become a shared value? It becomes a shared value because as people become more aware of hygiene and awareness, our market opportunity grows. As more people wash hands, you can sell that much more hand soap. I'm being very selfish and direct about it. On the other hand, by washing more, the sickness levels come down, and the essential, and you are also recycling a thing which would have gone to the landfill otherwise. So it creates a, a triple impact, single initiative with very little capital. It's all about ideas, and be committed to it and establish and embed it in your business model. We're doing something on skills. I can talk about it, but if the time allows.
Let's move forward. Thank you, Himanshu. Ravi.
Yeah, I think to us it starts with a vision statement at the top. It's all driven by the commitment that the organization displays in sort of tackling such problems. Philips, we have committed to touching 3 billion lives by 2025, and that's been a guiding statement for whatever that we do in India and other emerging markets. One of the things that I would say is co-creation, in the sense that you understand the clinical need, what exists on ground, and come up with solutions and products which sort of meet that need, rather than trying to retrofit a product developed for the Western market, because the workflow and the utilization could be so different. The second thing is, as we pointed out earlier, it's going to be content education of the masses in terms of why they need to do what they do, and how is compliance going to sort of help them in their sort of endeavor to good health. The third thing is collaboration and open innovation. I am sure Philips cannot invent all that it needs to solve the world problem. Question is, how are we open to collaboration with other institutes and other people who have similar such offerings, and try and build a system together more as an integrator, rather than trying to sort of do all on your own. And then, of course, the use of telemedicine and mobility in terms of providing the reach where otherwise you would never have got expert advice. We have demonstrated this in India, we have done it in Africa, we have done it in Indonesia. Enough and more examples to sort of prove the point there. And maybe that's what Vatsalya and others are also sort of riding on. Sure. So that's where it is.
Ashwin.
Yeah, I would say two things. One is the approach, particularly in healthcare. I think all of us as responsible citizens and part of these organizations have to start thinking away from prevention. And I say this in a different format. I think a lot of focus is on preventing disease. I think we are not focusing on making people healthier, right? I think the minute you start thinking about keeping healthier and move away from let's prevent this disease, that disease, it changes the whole game. So I think a focus, and at Ashoka we call this vitalness. How do you create vitalness for people? Because you really start thinking about illness at a certain stage in life, but even at the younger age you should start thinking about how can you, for example, nutrition is one big piece. Mental health. Nobody talks about mental wellness, as a core requirement. So how do you move that discussion? The second piece, I think, which we are pushing at Ashoka is very relevant, and we call it the Walls No More initiative. I think it's time for different stakeholders to come together. For example, any discussion around health should not only have people from nutrition, but should also have people from Chetna's organization, because they are in the community, they are talking. So a platform for corporations, social entrepreneurs, community workers, and public health facility. Those are the kind of discussions we need to bring in, because health is no longer a medical field at all.
Very, very interesting. I would like to open it up for questions. We have time for one or two questions. Anybody from the audience who would like to ask a question here, please?
The idea that a group of corporations and government would get together and create a pathway to assemble all of the things that are needed to make the investments pay off. It seems to me, if you look at the situation in India, and the story I told at the end of my session was an example where, there could have been a pathway, but it didn't happen. So I guess that's really the question: could you create that corridor idea, but make it around healthcare in India, and create, in essence, a whole range of partnerships where the co-investing against each of the problems reinforced the co-investing against the other problems. And if you use the corporate word of shared services, most big corporations have a shared services organization. So what you do is create a could you create a shared services organization for that healthcare corridor that would offload a whole bunch of the stuff that each individual organization would have to subsume otherwise? I mean, is putting those ideas together a way of moving forward in India? I don't know.
So anyone, Geetu, what do you think on this?
Yeah, I mean, I would agree. I think one of the fundamental unlocks that's needed is for there to be fearlessness. Fearlessness amongst, corporations, amongst sellers, about putting information in the hands of people who make choices. So, I'm fearless about telling you that if you do X, Y, Z with your health, you won't land up on the heart surgery table. I should be fearless about telling you that if you make these choices, you may not necessarily choose what I market to you all the time, but it'll be one of the things that you consume as an indulgence. So I think the fundamental unlock that's required is to be bold and say that, I am going to put the power in your hands to choose. Because honestly, if the ocean levels rise, everybody rises with it, and you create a virtuous cycle.
Siraj, would you like to go for this, as your point of view on this?
Yeah, I think the point on information, our challenge today is, and particularly with respect to food, that there is information, and it's a subject where everyone has a view. And that is probably creating a lot of confusion also. I mean, in India, we face that through our regulatory authorities, but I think the harmonization of information, I think somewhere some effort needs to be made where at least some pieces of information is universally agreed rather than everything being debated. And that creates a lot of confusion and leads to people then being selective in what they put out.
Awesome.
Yeah.
We'll just go to the next.
Yeah, my name is Bramley, and I'm a social entrepreneur from Shillong, Meghalaya. I'm just catching up with what she said, what happens when the ocean will rise. In the context of climate change, in the next 10, 15 years, when the ocean will rise really, or storms will come, or droughts will happen, and we'll have a major problem with food security and the public implications of climate change and public health, how are you guys going to prepare for the future? We were just talking to Ashoka Fellow. In 2004, things are different in 10 years. With the big climate change summit coming up in Paris, what world leaders will decide, which failed in Copenhagen. The next phase of the Kyoto Protocol, what's the responsibility of the corporates, or the goal number 15 of the SDGs, which is about environment and adapting to climate change, especially in food security and public health. There's places where there's no malaria, no dengue, because of the heat going up, the belt of malaria and dengue also moves up to the highlands, and people are dying like flies. Let alone they're already dying, but there'll be much more, millions dying from changing weather patterns in the future. How are you going to cope on that?
Yeah. So, Himanshu, I think you might want to hazard an answer here. And because this topic I know is very close to your heart, and you've been talking about this to me at many occasions.
I do want to clarify though that when I said ocean levels rising, that was more figurative.
Okay, now that's very interesting, but then we will still tackle the problem of the
But now that we are down to the real oceans, some of these things are very real issues which we face, climate change, and we already started feeling the heat of it. The good thing is that the corporates are much more aware today, and a lot of organizations, and there's a momentum building in that, whether it's a climate disclosure program or a WWF program or a water roundtable and things like that, a lot of stuff is being done to contain it. But what I hear from you is the health implications of the climate change and how we're going to address it. Actually, I'm the wrong guy. I'm not really. What I believe is still that the fundamental thing is still in prevention, whether it's by better education or for nutrition or sanitation or self-health care. It's in the power of knowledge is in letting people know how can they manage a situation. And as corporates, unless we come to a single kind of an entity, which I heard a corridor being talked about by David, or create an agency, an initiative, and CDP or a WWF or all these corporate initiatives which take different shape, and they come forward and say, okay, we stand for this and we stand for this. They're still very fragmented, and I agree with you. And we have a long way to go for coming to that kind of a. You yourself mentioned about the Copenhagen talks failing because the nations can't come together. So when there are so many ideas in the marketplace, there would be disagreement. People will not easily agree. But when a small group starts becoming successful and you keep repeating the idea, the things start falling in place. So I don't think I have a straight answer for you how the corporates are going to do it, but corporates are probably going to align to an idea in my mind and pursue in their own way.
Siraj, the last comment is for you, and then we have to.
Quickly, I think the basic thing is that the world will have to learn to do more with less. And that's about conserving resources, and that does involve technology, investment in technology, which encourages producing more with less resources, whether it's water, fertilizers, pesticides, or whatever. And I don't think that it's only the corporates which own that responsibility. That's a shared responsibility, right from the consumer, from the farmer, the corporates, the consumer, the supply chain, and the government. So I don't think the problem will be addressed by one section of the society taking ownership. I think everyone will have to take ownership, some more, some less.
Ravi, you wanted to say something?
If I can
Not more
add
than
to
30
that.
seconds, please.
Sure. If I can add to that, industries have their own norms. For example, reduction of hazardous substances is something that we look at. We ensure that for electronics cleaning, we have stopped using alcohol, we use water-based content. So industry is also trying to do its bit in terms of ensuring that the environment degradation is also sort of reduced. And because we also know that unless we do this, we don't get the certifications anyway. So there is a sort of a tie-in between the regulatory agencies and the engineering organizations in trying to minimize the impact that it can have on the climate,
So,
the adverse impacts.
Ashwin, you wanted to say something?
Yeah, I was going to say that let's not put all our faith in corporations. Right? So let's move on.
So that's very interesting. So on this very interesting, masterful statement, I think we will have to bring to this session to a close. But I'm very proud of announcing a fact that we have 3 organizations represented here on this podium who have received the Porter Prize for creating shared value or in other format. So we have Unilever, which accepted the award last year, and Sanjeev was there. We have Himanshu, who had actually accepted the award, and of course Vatsalya and Ashwin. So they are supporters, and I would really request all of you to really. So, and I would also like to invite the organizations who have not been supporting the initiatives to support. So special call to Cargill and Unilever to really come and support the initiative and be part of it. And it's actually going live on television, so you have to say yes or no. Thank you. So kind of you. Thank you.